Excellent. Good evening, everyone. Welcome to our third series of our Let's Talk about our 21-day equity challenge around gender-based violence. My name is Becca Cotto, and I'm the Director of Racial and Social Justice for YWCA. And we are doing this event in partnership with the Delaware Coalition Against Domestic Violence, whom Carolyn is a member of. And so I can go ahead and introduce you all. I won't read your full bios because you've done so many things that I would be reading quite a bit. But Carolyn Morgan, she's been the Delaware Regional Director of Progressive Life Center since 2007. The agency is headquartered in DC and has other offices throughout Maryland and Pennsylvania. The array of services provided by the Delaware office include treatment of foster care, independent living, parent partner program, a crisis support program, and other child welfare services. Carolyn has resided in Delaware for 3 decades and has a strong history of community service. She has served on the leadership board and various committees of the Delaware Coalition Against Domestic Violence and several other social service agencies and nonprofits. All right. And Carolyn, if you want to say hello.
Hi, this is Carolyn. I'm also a volunteer for YWCA Home Life Shelter.
Oh, wow. We're everywhere.
Yeah.
That's wonderful. Thank you, Carolyn. And next we have Deborah Gilbert-White. Deborah is a diversity and inclusion specialist, a social justice and community advocate for people experiencing homelessness, at risk of homelessness, or formerly homeless. She's founder of Herstory Ensemble, LLC, an awareness, education, and advocacy community-based group focused on women and homelessness. She serves as a member of the National Coalition for the Homeless Faces of Homeless Speakers Bureau, where she shares her story and work connected to homelessness across the country. Go ahead and say hi to everyone, Deborah.
Hello.
And then last but definitely not least, we have Jalissa Coriano. Jalissa is a PhD, MS. She's a native to Puerto Rico. Jalissa is a Spanish-speaking clinical social worker and sexuality therapist that centers her clinical focus on issues impacting the Latinx community, particularly the undocumented, the LGBTQIA community, and the sex trafficked community, with a 30-year scope of community advocacy and experience. Jalissa is known as a blueprinter and a community connector, creating events and organizations to support and empower the oppressed. So I'm so excited to have such an esteemed panel here this evening. Thank you, ladies, for taking time out of your day and a beautiful spring day that it is to be with us tonight while we talk about this very important issue. I'm going to kind of give a warning to any of our listeners that sometimes when we get into conversations like this, there can be things that are triggering or upsetting. And so just want to make sure that you know that that might be what the conversation tonight may be. So just making everyone aware. And so first I want to ask this question that I didn't prepare you for, but I think it'll be an easy one. Both of you have your own business, Jalissa and Deborah. I would love to hear real quick, I'll start with Deborah, because Herstory, I don't know what that is. Could you tell me what that is?
Well, Herstory Ensemble,
Herstory Ensemble.
LLC. It is a community-based organization that came out of my experience of homelessness. Since I am a woman, I wanted to have focus on other women who were experiencing homelessness, who were at risk of homelessness, or like myself, were formerly homeless. And what we are a policy and advocacy organization. We work on issues of mainly preventing homelessness and what we can do in community to prevent homelessness. We don't do social services, but we connect with people who do social services. Our piece is basically legislation and policy.
Okay, great. And what I was referring to, Jalissa, before I saw your face, is the Orgullo.
I have a glitter shop. I own a glitter shop. Is that what you're referring to? My own business.
No, I don't want to pronounce it wrong. Orgullo, Delaware.
Orgullo, Delaware. So
Yes.
I have a couple of things and Orgullo Delaware is one. So I have my own private practice as a clinical social worker and sexuality therapist. And so I do focus and center intentionally my work around the Latino community, Spanish speaking, undocumented, within that scope of undocumented, the victims of crime. And I help people through the immigration process,
Yeah.
and also the sex traffic community. So providing condoms, resources, anything that they need for them to be well and safe. And also the LGBT community, particularly the transgender community. And so Orgullo Delaware, which translates to Delaware Pride in Spanish, is it's the only clinical platform in the state of Delaware that serves the Latinx community and their families. Because in addition to just all the other barriers that the LGBT community experience, we have other barriers in terms of language and culture and religion. And so it's just really helping the families, especially the undocumented, helping the families be well and safe and accepting and affirming, and validating their thoughts and feelings. And then also the individuals who identify as LGBT get resources and everything else they need. So.
Okay, awesome. Thank you. And then Carolyn, if you wouldn't mind, I mean, I know what the Delaware Coalition Against Domestic Violence does, but if you wouldn't mind kind of giving our audience and those who may not know just a little bit of background and maybe your history with the organization.
Well, Delaware Coalition Against Domestic Violence, first of all, is a real coalition of member agencies that together try to address the issues of domestic violence in Delaware, of course, with a proactive prevention model. In addition to the primary agencies, which YWCA is one of those, there are a number of subgroups of people who share that mission, that statement, that concern about domestic violence. And within the agency, it serves as an umbrella for a number of other subgroups, including the Women of Color Task Force. Of course, that's the best committee, right? There's Delaware Men, there's Weaver, but what frog wouldn't croak about his own pond? So the Women of Color Task Force actually has been in operation. I joined, I think, in 1999, so I'm kind of dating myself.
You were only 12 then, though, right? You were doing, yeah.
I think 11. I think I was 11. But it probably, and I am very active in the community, but to tell you the truth, that group is near and dear to my heart. I feel like we make a real difference in the communities of color. It's made up of awesome women like Jalissa, who each have concerns about women of color and their position in Delaware, and the differential systems that we have to deal with that are not the typical Caucasian white female. And I think that's important because domestic violence looks different through each cultural lens.
Yeah.
Yeah, no, absolutely. And speaking of that, Jalissa, why don't you talk a little bit about your kind of your area of expertise and what those lenses are, the intersectionality of those, and kind of what you do.
Sure. So I kind of just broke it down a little bit just to gloss it over, because I'm sure Carolyn and Deborah will go over like the meat of it, right? And so for the Latino community, intimate partner violence is the same barriers and issues that others experience, but we have more because especially other factors, especially for the undocumented community. It looks very, very different, intimate partner violence. So quickly, the language barrier is one of the biggest ones, right? So you come to this country and you don't speak the language, you don't understand, read and write it. You're not really sure where to get services, how to get services. And so that really impacts the way that we receive services or even seek for it. Immigration status, huge. And so that is fear of deportation, under the constant threat, not only just by, society. Every day you get into a car accident and, that can bring up an issue for deportation. You can, something happens at your job, but also your partner can use that as a threat. So when your status is here and you're not here under a legal status, you're constantly under the threat of deportation. And so on top of that, you have children, your children are born here in the United States and you don't have legal status here. So that's a stressor in itself. It's definitely a tactic that abusers use to coerce individuals into staying in relationships or doing what they want. Okay, you can go back to your country, but the kids are going to stay here because they're citizens. And so we see that a lot in the Latino community. Fear of the police. And so we're already not trying to engage with the police because of our immigration status. So we're not trying to bring any kind of police interaction into the home that will result in them questioning our status as citizens here. So you'll see that a lot of Latinas undocumented, I'll just speak about the undocumented community because I'm pretty sure it's for everyone, the Haitian community, everyone. You'll see very limited contact with the police because of that, to avoid any questions or concerns about their legal status. And then also isolation is really huge because we don't have families here. We're sometimes here alone. And so it makes it really easy for an abuser to use that as like the primary tactic. You don't have anywhere to go here in the United States. Where will you go? Of course, you're going to stay with me and deal with this. And so those are some of the things that the Latino community encounters quickly. The LGBT community, again, some of the same factors, the psychological, physical abuse, emotional, financial abuse, but also one of the biggest issues in the LGBT community is the threat to be outed. And so one of the tactics that abusers use is, oh, your mom doesn't know that we're together, so I'm just going to tell her. Your coworkers don't know that that you're gay, so I'm just gonna tell them. And it's one of the biggest tactics that abusers use to keep someone under control, right? With the LGBT, with the transgender community, they really have some serious barriers and trauma with abuse. In addition to all the other ones, they have not only the coercion and the threat of being outed, right? But also the trauma of their partner abusing them in relation to their gender identity. So saying to them over and over, you're not a real woman, you're not a real man, and constantly being broken down psychologically that way. In addition to being kept from gender affirming medical assistance. So I'm transgender, I need my testosterone or my estrogen. My partner knows that I need money to pay for that. This is where all the intersectionalities come in. My partner knows that I need money to pay for this, and so uses that as a coercion. Well, you can get your hormones this week if you do A, B, and C.
Wow.
And so we see that as a huge problem in the transgender community. And finally, the sex trafficked community, again, obvious what they go through in verbal, emotional, not only by their John, but also by the people who solicit them for their services. They're going through the same type of abuse. But a lot of things we don't hear too much about, which is gender-based, it's violence against them, is all of the medical trauma and reproductive trauma that the sex trafficked community goes through. So it's their bodies going through forced and unwanted pregnancies, unsafe abortions, multiple abortions, sexually transmitted infections that, if are left untreated, affect vital organs and their reproductive systems, HIV, and they're at risk every single day, several times a day, for this type of violence. So, yeah.
Wow. Wow. Yeah, that just
briefly covers my communities.
Yeah, well, I mean, that just goes to show how intersectionality, piles on top of, one thing on top of another.
Absolutely.
Which shows, just the more barriers, that our community set up for us to go through. Thank you. Thank you for sharing that. And then, Carolyn, I'm going to go over to you because we kind of just talked about sex trafficking. So talk a little bit about your work there, and maybe because you seem to say that you policy was something. Talk maybe a little bit about the policies. I think there were some policies passed last legislative regarding sex trafficking. I think where basically if you were caught with drugs or something that you weren't to be prosecuted if you were involved in sex trafficking. Um, do, it's okay if you don't know what because I just threw that
Well,
at you.
I can tell you my only or my primary exposure to sex trafficking is I spoke to my work with Progressive Life Center over the last 14 years.
Mm,
My teen population going into young adulthood up through the 22nd birthday is our clientele. And of course, youth who have not been parented in traditional ways that have been part of foster care systems and related systems are more vulnerable. They have not been shown the level of love and concern that maybe those of us who grew up in traditional families have received. Sometimes it's an issue of looking for love in all the wrong places,
right.
the need for attention, whether it's good or bad. Um, Certainly at risk for sexual abuse, physical abuse, because they've experienced neglect and all kinds of trauma more than anything that we would see at our ages. Of course, I don't know how old, I'm sure Jalissa's 12 and Deborah's 13, but that it sometimes just unimaginable horror that they have been through before they reach my agency and my services. And of course, I thank God for people like Deborah who have addressed the housing and homelessness issues because they're real for all groups that are involved with domestic violence, but certainly the most vulnerable. I mean, that's a major issue. Those groups, they have less opportunities for education, for careers. There's so many things, particularly in communities of color, where the values are different, where, like Jalissa said, you have reasons why you don't leave, no matter what the situation is. Sometimes it's related to poverty. Sometimes it can be related to racism. You're reluctant to make that call because of your community's relationship with the police.
Mm,
Our racial views are often very different. For African American women, they have a stronger religious base. They go to the church for counseling and support more than they go to social service agencies. So your lens is, family impacts your decision making more than it does in white communities. The whole poverty issue stops so many things.
yeah.
Those groups, and particularly, I think in this last year, we've seen that racial prejudice and discrimination, uh, and how real that is, how movements like Black Lives Matter. I think my last year with this whole Trump thing, and I'm worried about COVID-19 and all of the racial injustice. I mean, it was compounding for me. Can you imagine a survivor?
Yeah.
What that would be, and in terms of mental health issues. Now, granted, I know Jalissa and I are both, clinical social workers, but the mental health impact for survivors is so much greater than the many things. I mean, I had Trump to worry about, COVID, family health issues, but I didn't have to worry about my day-to-day safety and existence in my home. So just imagine that, uh, to whatever power that exists. So that's why I stay at this game. That's why I've done it so long, because there's so much to do. There's so many groups to advocate for, and it is not all about the white female. And I got to make that point,
No,
because that's what's presented.
yeah, no, that's exactly why we're here. That's why we're talking about this, is because that is what's presented. The damsel in distress, right? That's the what our narrative always is the the white woman, and she's the only victim. So that's really not reality. Deborah, let's
Yes.
talk a little bit about gender-based violence when it comes to homelessness. I know that there's a large population of people who experience violence, domestic and sexual violence, who
Mhm.
stay because their fear of homelessness. And then there's probably a large population, or a decent population, that leave, right, and become
Mhm.
homeless because of those reasons. So if you would talk a little bit about your relationship and experience with those.
Mhm. First, I would like to say that there's not any one of us, or not too many of us, who have not have the issue of violence as part of our stories. We live in a violent society. We see it on television. Our children play these games on video games on computers, and so we have been heightened to accept violence on many different levels as it comes into our homes and into our psyche. One of the things I want to also say is that when we talk about gender-based violence and homelessness, we're really talking about loss. It's a loss of people not having security, not having housing. It impacts self-esteem. It also looks at brings to the forefront issues of blame and shame and things that will keep women, in a situation, or question themselves whether they deserved it or not before they make a move. Homelessness is one of these things that when people are traumatized and they have no place to go, when they are traumatized and are questioning whether they can find a safe place for them and their children, it becomes a real struggle to find that space. One of the things that our organization, Her Story Ensemble, does is to help empower women who find themselves in situations after they have connected with organizations and groups that do the basic needs piece, to help people to understand that you can advocate for yourself, and that to understand what they've just gone through, that it is not their fault. I think that's what the abusers have done, is to have women question themselves. And it's not only women. When we look at gender-based violence, we're also looking at this as an international problem as well. And also, depending on who your partner is, it could be another female also abusing another female who is their partner. So we have to also look at how do we expand the narrative around, gender-based violence and different types of relationships in our society. One of the things that we work on is looking at prevention. And so, how do we get the information to people who have been victimized, people who are in these situations, so that they're able to be part of the solution for getting the help that they need and being made to be sustained in the community. One of the things that we look at is how do we talk to landlords? Usually when a woman is a victim of, or a person is a victim of domestic violence, they have a very spotty um, um, work record. They have moved multiple times, so their credit and their housing information is also spotty. And so they are trying to do things to continue to protect themselves and their family if they have children living with them. Another piece is to see how we can help landlords when women are being faced with eviction because the property manager or the landlord thinks that they're destroying the property, the abuser is, and so it puts their housing at jeopardy. Or they don't like the idea that police are always, or law enforcement always coming to the resident. And so they look for ways to evict. And so one of the pieces that can help with that is having people who are facing eviction have a right to counsel so that landlords, I think it would be a deterrent to a landlord that that she or he can just put someone out because they are been victimized by domestic violence. It would be a deterrent to keep people housed. And so, it's just helping people to understand what the dynamics are of gender-based violence, how it impacts a person's work history because you go into court to try to press charges and to keep your children and all those things, and you're missing time at work. And so your employer may not be as understanding or may not even care because, they need to get what they need to get done while that's why you're working there. So it's just all these other things that tie into it, um, and and the forms of domestic violence,
Mhm.
and the forms of gender-based violence, psychological, physical, emotional, and what I just shared, which was mostly the sociological piece of it,
Mhm.
that this is how it impacts women on the practical level every day, day to day.
Yeah, thank you for all of that. That's a lot. So I want to talk a little bit about. Oh, this is echoing a little bit. And again, feel free to join the conversation or but right now in the news, there's the conversation around the hypersexualization of Asian women. And so that's kind of brought a lot to the forefront, I think, of conversation that, I was talking to Deborah earlier, and I think our country is having, a what's it called? What did I
You
say?
said you said identity crisis.
Yes, we're having a bit of an identity crisis because I think the reality of who we are and what we've tolerated is slowly creeping into every crevice of every aspect. So if you want to share a little bit about, maybe this week and what you might think about us now having this conversation about the hypersexualization of Asian women and young girls, right? Because that's a huge system there as well. Is the sex trafficking.
And additionally, women that are generally at the lower socioeconomic level as well, working in jobs that are low paying, menial. I've really just gotten to the point this week, probably yesterday, to be able to even address that whole Asian American victimization. It's been a lot for me to process, and it burdens me that someone could even say they had a sexual addiction, and that excuses you from racial, cultural uh, hatred
Right.
against a particular group.
Right.
Um, it has had my blood boiling. I'm
Mm-hmm.
telling you. That in America 2021, and it's not new, but
No.
it's coming to the forefront because
Yeah.
we've lost a number of women to violence that should have never occurred. But like you said, it's across the board. And it's not like there's any group that is not impacted. Um, and we talk about Deborah policies, and that's where it's at.
Mm-hmm.
That's where the changes have to take place. But you have to call a spade a spade. And if it's racial, cultural violence, that's what it is. You can say
Mhm.
everybody, a lot of people have sexual addictions. That doesn't excuse the behavior. It's still an act of power and control, of view, of power and control, where women are expected to be submissive, sexualized, and that's how you're identified. That's difficult for me. It is really difficult for me.
Yeah.
I think generally I have this whole thing under control, and I'm a social worker, and I've worked in DV for decades, and you should have it all together. But when this happens, there's something that kind of, because your heart is there, your concern is there, there's something that comes up and say, we can't allow this. You can't be a woman, you can't be a person of color and be okay with this. It can't happen.
Right.
Just my view. And
No.
like I said, even last week, I wasn't even discussing it because I couldn't do it sanely. You know,
Yeah.
Yeah, apologies if
Yeah.
the
I had to really step back and really look at it, and my what got me boiling is the fact that, who decides what's a hate crime? That
yeah,
whole conversation, who decides that? It's also like, who decides when you have been traumatized and abused and raped, when you need to get over it. It's that sign, that kind of assault, to the psyche and to your emotion. And I teach a class on the cultural diversity, and I had to reach out to my students, some of them who are Asian American and Pacific Islander, and just, I said, we have to do better than this. We have to do better than this. And some people say, oh, we are better than this, but no, this is who we are. And we have to
that's
really own that and know that we have people walking among us who hate people who are specific races and ethnic groups, who hate people who are homeless, who hate people,
that's
who are poor. We have to be honest about that. Those people do exist in great America. So, we need to do more. People who are advocates, people who are allies to different groupings of people, we need to do more and to step up to the plate and be supportive, and show that allyship.
what is it that we can do? And
Okay,
this,
can I get a chance to
oh,
answer that for a second? Yeah, thank you.
absolutely.
It really hit me on a different couple levels when I heard about it, and but not in order. I'll just mention. So for me, as a sexuality therapist or an expert in sexuality, it enraged me that the term sex addiction was thrown around as a reason for this happening, because there is no such thing as a sexual addiction. There just isn't. There is serial compulsiveness, right? So you can have serial compulsiveness towards sex, masturbation, shopping,
Mm,
knitting. You can do whatever.
healing.
It's a
yeah.
serial compulsion. So there is no such thing as a sex addiction. Because if you remove the sex out of it and you look at this person's life, he may have had, like, addictions with gaming, or issues with, buying guns or over shopping or whatever the case. We have to look at it from, a general perspective that way of compulsion and addiction. So that was one of the things that stood out. I'm like, do not bring this term to the media. But above that, like, it speaks to violence against women. It speaks to labor trafficking, most likely, that was happening there in the massage salon. It speaks to so many different levels. But to
Mhm.
answer your question, Becca, like, I feel the sexualization of Asian women has existed forever. Like, if you think about, like, the wars, and I'm off on my world history bit, or
No.
like World War I or II, like when they were, like, in Vietnam, and
Oh,
yeah,
World
right, in
War
Yeah.
One,
Vietnam, in Thailand, in the
Mhm.
Philippines, and
and
Yeah.
every war.
soldiers would bring girls, Asian women here. We've seen it with geisha girls, we've seen it with everything. And so I don't think this is anything new. And I have to admit, I don't own a television. I don't have social media other than Facebook. So my information may be outdated. But I feel like there was a time where like every athlete had an Asian partner. And so I started seeing that and I'm like, what is that about? And so for me, it's always kind of been there. As a Latina, I remember doing my graduate degrees and my doctoral work, typing in Latina to do Latina sexuality, and all that was coming on was porn and graphic material. And I'm like, well, where's the research related to my community? And back then, for 2014, 2015, there wasn't anything. So I'm trying to do like master and doctoral level information with porn because that was all that was available. And so the sexualization of exotic girls, brown girls, has existed.
Yeah,
That's the beginning of this time, right?
yeah, that's what I was listening to an interview on NPR, and that's what the discussion. It was between an Asian reporter and an Asian woman, and she was talking about a lot of it does stem from the wars, and not necessarily even bringing women home. It was over there, sex, because of the American soldiers, sex was big business, and it was constant, and there were places that soldiers would go to, all of them. And so she said that's kind of where it stemmed from, where this, this mysterious, but you're right. They're talking about geisha girls, like it's always kind of been this mystique. And, I think every woman of every race deals with kind of a different type of sexual, I don't even know, their terminology, fantasy, whatever you want to say, I think, it's just put on us.
Yeah. It does become a fetish, and I haven't read too much about this person who did the shooting, but I can imagine it became like a fetish for him. And so that's a whole different thing. But the sexualization
that he visited 2 of those massage parlors where they had records. So I mean, this was obviously not just some random
isolated thing, right?
For sure. I mean, and probably more than 2 of those massage parlors. I mean, that's not usually something that's one and done.
Right. Definitely. And you think about the girls that are in there, the women that are in there working, and it's just like, how did you get there? So is it through labor trafficking? Is it sex trafficking? And we need to, address the violence against women. And so, so that's really important.
Stereotypes. That's
yes.
the part that got me. Like if they see you and you're a woman of color, or if you're African American, can you dance for me? What?
Yeah.
You know what I mean? That is common. You look at somebody. I read an article, I think this weekend, from an Asian American reporter who said it is norm for her, for people to come up to her. Now she has a doctorate degree. She's been working in this industry, but people's comments are sexual to her. Can you imagine that? I mean, that's just unbelievable. Unacceptable. Based on your cultural stereotype, you decide it's okay to be inappropriate with me, to be violent with me. Not acceptable. Becky, you started saying, what can we do though?
I was going to ask you, as a community, what can we do? What are either some of those policies, or what can we do as allies? How can we support, women and women of color, and the LGBTQ community? Like, what are some actionable items that we're able to do?
Well, I think one of the things
there was a petition today. There was a petition today about the Asian American women that came early this morning. So at least somebody is mobilizing, saying we want signatures of people that agree with us that this will not be tolerated. That's one way. There are a lot of grassroots ways, but I definitely signed my name and forwarded it to everybody that I knew that would be willing to support. This doesn't agree with us, and we're tired of it, and we want something done.
And I think also what we're finding also around the country, the response in the Asian community, specifically the community itself, of people who are rallying and pulling together and bringing this to the forefront. You know, people are always saying, people are always marching and they're doing this and they're doing that. But listen, it works and it brings people
That's
together.
right.
You know, it brings people together, and it also brings awareness and education around the issue, which is another piece that we need to have these conversations, you know, among women of color and among women, white women, and everyone, and not only just the women, but everyone, to see where we can fit in, where we can make the difference. What is our sphere of influence where we can make a difference on these different types of issues? One of the things that I would like to say, going back to the last question, was, you know, on that day, here it is, Women's History Month, and on that day, 8 women were taken from us violently. They were mothers, they were children, they were aunties, they were grandmothers. I mean, it's just, you know, it's just unacceptable that people going about their lives, living their lives, you know, someone else makes a decision that this is your last day. You know, and so, you know, how do we continue, you know, to, you know, value women and you know, and teach, you know, people that, you know, that's not your right to take somebody's life like that. It's just not your
Mhm.
right.
Well, one thing that we can be encouraged about was President Biden and bad behind Kamala Harris got on a plane,
Yeah.
who is part Asian American,
Yeah.
went down there and said, hey, we have our close eye on this. We will work towards a resolution, and they didn't waste time. They hopped down there 2 days after the event. And I was pleased to see that because it speaks as a nation, when you have your leaders saying, we got to deal with this. And that encouraged my heart tremendously because we have, the top 2 leaders in America taking a stance like this does not settle with us. And that was powerful for me.
Yeah, thank you. Um, Yulissa, you have anything that you think that we can do as a community to help support?
I think my hermanas, it just talked about it brilliantly. I think it's just stepping up and just doing the right thing. That's what it's always been
Mhm.
about for me. I have recognized from a really early age that the universe, chooses us to carry out certain missions, right? And certain purposes. And we all have a purpose to our life. And I know that mine is social justice and standing up for those who are oppressed and marginalized. And so one of my favorite people in the world is Saran Cade from the Department of Justice. I love him. I adore him. And in the Public Allies, I think it was like 2020 Public Allies. Becca,
Where I met you, by the way.
yeah. He gave this speech, and what stood out to me is that he said, "Be good at being good." And so that to me just kind of embodied everything that we should be
Mm.
carrying with us, right? So it no longer becomes a black and white thing. It no longer becomes a male female thing, a gay or straight thing. It becomes we really are human beings, and if we're trying to live this world as peacefully as possible, just be good at being good.
Yeah.
Do the right thing. Stand up for people. Like forget about what the history is between two races or 2 cultures or whatever that's negative, and like bring it to right now where we can make change and peace together. And that's what I'm really looking forward to. So
Yeah.
on a basic everyday level, because some people aren't policy people, some people aren't
Mhm.
protest people, so you have to find out what advocacy means to you
Yeah.
and implement it, right? And so it simply could be, you know I saw one time a lady at the dollar store, it was a Spanish speaking person. She helped him figure out how much money to pay. That's a form of advocacy and peace that we
Mhm.
should all
Right.
be doing,
Mhm.
right? So
Yeah,
even
you're right.
small as that could lead to beautifulness in the world.
Yeah.
Yeah.
We all do have our role, and you're right. It's not everybody policy isn't everybody's lane,
Yeah.
and some people are what they call frontline, I'm sure you've looked at that social, can't even think of the dynamic of it, but it gives everybody a different title, and one of them is frontline workers, and one of those is caregivers, and some of those are, listeners, and it's like, who are we in that mix of bringing our society to a place where we do see the humanity in everyone. And we have a long way to go in there. We're like I don't even know, my clock went away, but I want to give the audience an opportunity, if they have any questions for our panelists. You guys can go ahead and pop it in the chat.
Can I add one thing?
Oh, please.
I'm gonna put Deborah on the spot.
Yes.
In her signature line, she had an awesome quote. Deborah, would you be willing to share that? Because to me, that was powerful, and that was an answer to some of the things that we're facing today. And it struck my inner core. Would you mind sharing that?
I don't mind, and I should have it memorized, but right now I just went blank when you asked me, so I'm going to pull it up. Can you hear me?
Yes.
Okay, let me see if I can pull it up. It's a quote by Angela Davis. And basically, what it says is, okay, let me just open this up right here. Okay, one moment, please. She basically is saying that she doesn't, she is no longer looking at,
Is it the courage to change?
Yeah, she's no longer looking at not, oh gosh.
As opposed to the courage to change.
Waiting for change to happen and accepting things. She is going to change those things that she cannot
accept. Yes.
So that's basically what the crux of it is. Yeah.
Exactly.
Being able to change the things. We don't have to accept things as they are.
Yeah.
That was my feeling personally coming out of homelessness, looking at the systems and ways that people look at homelessness. We can change what we are not willing to accept.
Yeah, you're right. You're right. So do we have any questions?
Yeah, that's something that I'll have for me, Deborah.
For our amazing panelists?
Yeah.
No? All right. So that's not a question. That's just kind of a thank to you guys, which is why I keep going off screen there. But okay, so we don't have any questions. Let me see. There were any. The one thing we didn't really cover, I think we kind of hinted at it, but and it's because I never knew it had a term before I started doing the 21 Day Equity Challenge, was financial abuse. And so if one of you would mind kind of going into that, I know we talked about it a little bit before, but what that means and what that can mean. And Karen asked, what a legal recourse can one take if sexually assaulted in the state of Delaware? That's a deep question. I don't know.
Miss Carolyn talked about the financial abuse, and it kind of like had a light bulb for me to think about, this COVID pandemic, some people received a lot of assistance, right? With stimulus checks and also, the unemployment pandemic assistance. But one of the things we have to remember that sometimes people share a bank account, and an abuser has control that way. And so even though the one person is receiving all this money, and if they're able to save it up, is able to leave, they might not have access to it to be able to pull it out of the bank account because they share it with the abuser. And so, Miss Carolyn, you had talked about that for like a second. It struck something in me to mention that.
On so many levels.
Right.
Finances determine where you live, what you can buy, your lifestyle, what your children can have, what your goals can be. So it's a powerful tool that abusers can use against you. Money speaks in America. One of the main reasons victims stay is because it takes money to get out of a domestic violence situation. Uh, food is important in America. If you have children, they need some place to stay. Housing is important, something that many of us take for granted. I think financial is probably one of the most devastating means of control, because in America, our system and our lifestyle is based according to finances. It impacts everything. I mean, I was stuck, Jaleesa, when you talked about transgender folks who are taking hormones. And if I take that money away, then that's a problem. You know, money is really what I hear from the many women that I work with that is a major hindrance and impairment. Because a lot of women, particularly in COVID, if you're working at a low level, lower paying job, you don't have the luxury like I have to determine when I'm gonna go into work and when I'm gonna do telework from home. You're in there day by day.
Right.
You're earning a paycheck that you may never even see. Or let alone be able to utilize or to kind of tuck something away for the future. I have right now people who slip me money for the day when they feel like they'll be ready to leave because they don't even have a safe place to keep it. If it's at home, the abuser can find it. I mean, they're not rolling up in my office taking what I got. You know what I mean? But that's not part of my job description, but I do it because I realize it takes money to leave an abusive situation. And I know that's what abusers, that's one of their main tactics, and it works because money rules America.
And even thinking about like how systemic oppression works also, it's like I'm ready to leave my abuser, right? But I need to come up with the first month's rent, the deposit, you know, my children, if I have 4 children or 5 children, they each, it's a 2-bedroom system for each one. So then I have to upgrade and not all live in a 1-bedroom apartment like I can afford. I mean, we're setting people up to be oppressed. On a daily basis in every single way, right?
And connected to that also is that, many times when women, well, most times when women find themselves homeless, and as Jaleesa said, they trying to come up with the money, or, they have help that comes through social services, having landlords that will accept, different sources of income to provide housing for them. And, this is really a pertinent issue right now. There is legislation that will be presented in a hearing this week on Wednesday before the Delaware legislation, source of income legislation. Is being sponsored by Elizabeth Lockman, and we have Marie Pickney, and also Brian Townsend, and a few other folks who are looking at that. But you're abused, you find a place, you're looking for a place to stay, you have funds that can help you have housing, but you run into an issue with the landlord, to give you that housing for you and your children. And so it becomes another education piece, of landlords understanding, that, women are looking, to survive. They're trying to survive. They're trying to get stabilized in that situation. And it does boil down to the dollars, to the money, and being able to do that. Yeah.
It even impacts, your self-esteem. You can't keep up your appearance without lack of money. It impacts your mental health if you're living day to day trying to figure how can I tuck away secretly a few dollars, because some abusers require you to show the grocery receipt. I know women who buy their groceries, get a receipt, and then say, "Oh, I had these coupons," and get another receipt just so they can save $5 or $6. I mean, because abusers are very manipulative, very knowledgeable at what they do, and it's hard in these times to sock away. That's what I tell my age again, sock away a little bit to keep things going for you without the abuser knowing that you're trying to depart. And as we all know, when you're leaving a domestic violence situation, that's when you're more at risk for abuse and unfortunately for lethality, for death,
Yeah.
in your attempt to leave. And that's unfortunate, you know that you have to plan ever so carefully with your victim about how can we do this safely without knowledge being made known to the abuser who cannot suspect or your life is in danger.
Yeah.
Right. Yeah, exactly. There's one question in the chat. I don't know if we know the answer to that. Asked what is the what legal recourse can one take if sexually assaulted in the state of Delaware? Do you mean like legally against the perpetrator, or like what kind of charge they press? Or Karen, I don't know if you want to elaborate a little bit more. Do you mean like I guess if the police drop the charges, what they can do? I think we need to be a little bit more specific. Sorry.
Well, the YWCA has a sexual assault unit.
Mm-hmm.
And whenever there's a question that I can't readily get, I'm on the phone to them. There are excellent staff that's very knowledgeable of the court system, the legal system. I hope Carly's not on this Zoom, but I'm calling up Carly Canada Banks, an expert in sexual assault and domestic violence. Ebony Hunter, who recently left the agency, but I still call her, "Hey girl, I got a situation, I need some help." I mean, honestly, if you contact the sexual assault unit, I think they are a great resource for guidance and direction, walking the victim through the process and the steps. So I'm not plugging them. I'm just telling you what my experience has been. They're an excellent unit. And they've never let me down or disappointed me.
Yeah,
So I hope that helps.
Yeah, I think so. And I'll get her that number. I know Karen. So, okay. So I think that might be all. Let me see. There was one earlier. No, it was just a bravo for not owning a television.
I've never owned a TV.
In your whole life?
No, I moved out when I was 19, never owned a TV. I don't listen to the radio. I mean, I think in a way it's better that way because I'm not filtered, like my brain is like clear to make decisions based on fact as opposed to influence of other sources. And I like that.
Yeah.
So
Yeah. I can't thank you ladies enough. If you guys want to make some closing comments or remarks, please do so. Deborah, do you want to kind of?
Well, I want to thank you for this opportunity, and I also want to share that I'm also a member of the Delaware Continuum of Care, and a lot of the advocacy work is done through our advocacy committee and also as part of the Continuum of Care. And so, I ask people that if you are willing or wanting to do something to bring about change, to look at the Continuum of Care to see, where you can fit in. And what committees you would like to work on, to help bring about the change. We have people who are doing different things connected to women and homelessness and to people who are homeless in general. And also to look at the preventive measures that we can take, to address homelessness. I believe that if we can prevent homelessness, that means that the pool of people that are experiencing is much smaller, and that we can eventually, have every person here who needs housing have housing and have safe, affordable housing in the state of Delaware. Thank you.
All right, thank you for that. Or Julissa, you wanna make some closing comments? Thank you again, Deborah, for being here.
So I just want to thank you, Becca Cotto, for inviting me, and definitely Deborah and Carolyn. It's been fantastic. Not only serving on committees with you, but just knowing you as sisters. So thank you for sharing this with me.
Yeah, definitely have some amazing women on tonight. That's
definitely. So thank you. I hope everyone benefited from the conversation and learned a little something.
Yeah, well, I did. So I don't know about everybody else, but no, Carolyn, thank you for being here. And did you have anything closing, anything you thought we might have missed or?
Yeah, I just wanted to let Deborah know that I'm going to steal her quote.
Oh,
so if you see it appear again,
it's all right. It's Angela's. It's Angela's quote.
You just know it in advance. I enjoyed myself. I respect my co-panelists. I had a good time tonight. I think every once in a while we got to get charged up. And I'm going to put my email in the chat if there is a woman of color that is interested in joining the Women of Color Task Force so that we continue these wonderful discussions and we actually are able to impact some of the problems. I'm just going to put my work email in the chat. Is that okay, Becca?
Yeah, please, 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 please. And then I can always, tomorrow when I send out a follow-up email, I can always put that in there too, put your contact information in there. And Deborah put her story Sambo website in there as well. So thank you all, amazing women, for everything that you do for the community. And I know you do it out of your hearts, but it's so, it makes me feel so privileged to know you and to just know that there are women like you out there fighting for people going through these experiences. So yes, Sue, thank you. So yeah, so I'm just giving everybody a minute to take Carolyn's email if they want it. But again, I'll put that in an email to everyone who attended tonight. And hopefully those who want to join us next week for having conversation on environmental justice. And Lisa Blunt Rochester is one of our panelists, as well as actually Chief Coker, Dr. Marva King, and oh, this is terrible. I'm going to forget one person's name. I wish I had forgotten two people's name at least. Oh, that's terrible. And I apologize to whomever you are that I forgot your name. But next week, same time, same place, just register on our website for that. And then if you learn something tonight, you want to share this event with someone, that will be also available on our website in the next couple of days. We'll get the recording down. And so if you want to, you can, ladies here or anyone on that listened, if they want to share some of the information.
Perfect. Thank you.
Thank you all.
Okay.
Have a good night. Hopefully you go out maybe another half hour, watch the sunset.
Yes.
All right.
Bye.
Bye-bye. Bye-bye.